Hello, my name is Monica Phillip, and I'm here today to welcome you to the final steps of your preparation to become a women's health nurse practitioner. As you prepare to take your board certification exam, I first want to recognize and congratulate you on making the choice to become a women's health nurse practitioner. I think you will find it to be a rewarding career with many opportunities for community impact. Second, I want to applaud you for taking the next step and focusing your studying as you prepare, not only for your board exam, but also for your new role as a nurse practitioner. I encourage you to not only see this as a time to solidify your learning, but also when you have a moment to let your mind be a little bit creative, to think and dream about how we may continue to improve the way we care for people and the lens with which we use to deliver care to truly meet people where we are. How can we do better? What are the limits in what we have already in our knowledge base as a profession? And how can you impact that in the years to come with research, with studies, with community activism, and with excellent patient care? I would like to now take a moment to help walk you through a little bit about what the exam will look like and give you an overview of the exam structure and content and some tips and tricks for high impact studying. So studying tips and tricks. A little bit about me before I continue. So I've been in practice for more than 10 years, both providing direct patient care as well as teaching women's health care. I'm currently both in clinical practice and a lecturer at the Yale School of Nursing. My clinical practice has been everywhere from working in community health centers to working in East Africa, working internationally, as well as in private practice. I'm also the project manager for the NPWH board prep review course. And so I have a little insight to share with you about that project and what we have to offer you in terms of resources. I have no disclosures. So the first step to thinking through studying, I think, is really taking a moment to get your ducks in a row. And first, familiarize yourself with the content of the exam. The NCC has a great study guide that you can go to online that goes through all the content that they recommend you review prior to the exam, and the breakdown of the content in the exam itself. As you can see here, 12% of the exam is assessment, diagnostic testing, and interpretation. Another 12% is primary care. Then the bulk of exam is focused on gynecological and reproductive health and obstetrics. 9% for pharmacology, and then 3% for professional issues. The exam itself, there is a time limitation of 3 hours. You don't have to use the full time, but it is available for you up to 3 hours. The exam will have up to 175 questions. 150 of those will be scored. There could be up to 25 questions embedded throughout your exam. You will not know which ones they are, that are actually questions they're testing to see if they perform well, and they'll include in future tests. All of the questions are formatted in the same way. There's a stem, the base of the question, and then 3 answer choices. Just 3, 3 answer choices for you to choose from. The questions are in randomized order for each test taker. So when it's done on the computer, they're random. It's not done in level of difficulty or content. It's all mixed together. The test both tests basic knowledge base as well as an application of the knowledge. When you're looking at the exam, I think it can be helpful when you're memorizing things to know what to expect when you see them in a question or an answer. So the laboratory values will be shown both in conventional units as well as international units. International units will be in parentheses. And then the drugs will be listed both by generic and trade names. So if you're more familiar with one or the other, they should both be there on the exam. It's good to know both of them, but if you know, you might recognize the generic or the brand name, they will both be there. When you think about prioritizing your studying, it can be a little bit overwhelming. There's so much content to cover. But some things to think about when you're focusing are thinking about obviously kind of the topic areas that have more questions, right? To make sure that you really have a good understanding of that core content, which you'll be using in your practice as well on a regular basis. But don't forget to study the areas that maybe aren't as comfortable or exciting and that you're less familiar with. Often I've seen people fall into the trap of kind of forgetting to study all that goes into primary care professional issues. There are those questions, and you don't want to give up your good credit of your points on things you just kind of forgot to study or you glazed over because they weren't your priority. Just remember to include that into your study structure and plan so that they don't get forgotten. And then trying to really come up with a plan, and then give grace to yourself when that exact plan doesn't work out as you thought. But trying to plan in advance to give yourself time maybe at the same time each day, time that's without other distractions where you can really quickly get into a focused mindset to work through the content that you have mapped out to cover. Most of you by this point will have a good understanding of your learning style, but if you don't, this might be a good opportunity to just do some quizzes online, see where you really fit in terms of kind of the general approaches of visual, auditory, reading and writing, or kinesthetic learning. So visual, are you somebody who really does best when you see images of something or watch a video about something? Is it better for you to listen to these lectures in the car or to listen to them when you are sitting and you can take really good notes? But is it better for you if you're an auditory learner to really be listening? Is it advantageous to you to have the opportunity to not just see images, but really read and write about these to help solidify that content? Or are you a kinesthetic learner, somebody who really learns by doing and using all your senses as you go through the content? And maybe you're a mix of more than one, but learning this about yourself and learning how to apply it as you go through this could be really meaningful, not only for this process, but for your learning process in the future. Sometimes it can be almost a necessity to really cram in a few days here and there, depending on what your life looks like. But it at all possible, try to take study breaks that you really do time and take on a regular basis throughout your studying. There's research that shows these little study breaks, especially if you can get out and move your body and get your blood pumping again, really can help you stay more focused and have more productive studying along the way. Studying multiple times throughout the day for shorter periods of time has also been shown to be more productive. And starting with the more difficult topics first in your study session also have been shown to maximize that amount of time that you're spending. You want to do that. You have a busy life, I am sure, with many things, and you want that period of time you set aside to be optimal in terms of what you do and how much you retain given that limitation in your day. You've probably all heard about this concept of active versus passive learning. I want to take just a couple minutes now to talk about really what that means and some ideas of how to make your content stick as you're working through your plan, your study plan. So active studying we know is more effective. So what are some examples of active studying? Writing down questions as you go through the content to later quiz yourself, taking a moment. So pausing a recording of a lecture, for example, or stopping your reading and write down a question that summarizes what you just learned with answer choices or the answer so that you can quiz yourself later, either in flashcards or just on your own, reading your notes and reminding yourself of the questions and then what the answer would be. Like I said, write questions down as you read, watch or listen, and then go back to them. There's research that shows too, going back to some of the core content you just learned within 24 hours of learning it, doing a quick overview of what you learned yesterday before you start what you learn the next day, or maybe halfway through when you need a break, just to remind yourself to reinforce that material, can be highly effective. If you're a visual learner, drawing images to help connect the concepts that you're learning, word pictures that can really help bring it in. If you're somebody who really thinks through using, acronyms or other things like that to help remember, those are all great tools to use right now as you're trying to really just get so much content into your brain and in this time frame that you have allotted to yourself to do. It can be helpful to talk through some of these processes, especially things that have multiple steps or that are similar but have some key differences that you need to memorize. So talking through the menstrual cycle, maybe to yourself, maybe recording yourself and then listening to that, maybe to a friend who's kindly, or maybe a study partner who will work through this information with you. Another example would be like when you're working through the content of, say, hypertension and pregnancy. What's the difference between chronic hypertension and gestational hypertension and preeclampsia in terms of how you manage those things and how you diagnose them and what tests you use and what criteria you use for diagnosis, and then for the management delivery plan, really talking through how they're similar and how they're different. When you make those connections, it really helps solidify the content in your brain of how these are overlapping and then the important ways in which they're different, and that really formats itself in your brain in a different way than if you just were memorizing each of these independently of each other. And then think about ways you can continue to test it and reinforce the material. So through test questions that are going to be like the exam can be very helpful. Also through flashcards, study cards, things like that, which you're probably all very accustomed to using. But the more questions you can do can also just really get your mind in that mindset of multiple choice and thinking through that critical thinking process that kind of exam has. Just as a refresher too, the passive, less effective learning, sometimes we fall into when we're tired or because we just want to feel kind of productive, but rereading the content a bunch of times is generally less effective. Taking notes without adding more questions or critical thinking to it is generally less effective. And highlighting, underlining your text can be helpful as you're going through it to bring your mind to what you're looking at and what's important. But if you don't take that next step and actually writing down notes and questions and those kinds of things, it's also less effective. So just trying not to fall into the pitfalls of doing a lot of work that may not actually be maximizing your time and the outcomes you want. I do want to make a note here about really jotting things down with a pencil or a pen. I think we've gotten really in a culture now of typing and using our computer, and there's a good amount of research now that keeps pointing back to actually that movement of your hand connects what you're writing to your brain in a different way than typing does. And so, that might not be a possibility for you. You might be on the go and need to use your computer, and, you'll work within the constraints of what you have. But if you have the opportunity to actually handwrite out what you're learning, that can be a highly effective way to also just solidify the information. When we think of the next steps here, you've done your studying, you've solidified the things, and now walking into the exam with confidence very well may help you do better than if you walk in with worrying and trepidation. So just a reminder to take care of yourself through the whole studying process and through your whole education process and as a clinician in the future as well, but especially during this high pressure time before your exam to be thinking about your health, your sleep, and your basic needs. I also encourage you to add in a buffer of time as you're studying, to not have it just to the day right before the exam, to have all the content in there as you map it out. But give yourself enough space that if somebody gets sick or you get sick or something else goes on, that you're not feeling like you're in a disaster situation of trying to catch up, but that you've offered yourself that buffer so that you can continue on and meet your goals without feeling like you really had to cram. We all know that sleep, the days leading up to your exam are important. Good nutrition, the days leading up to your exam and when you're studying, and then the day of your exam are also very important. It's a long test, up to 3 hours. So really trying to think of things that can help sustain you through that time and not give you a crash when you're partway through. Trying to eliminate unnecessary day exam stress. So that might look like a lot of things for you, but some ideas are things you've heard before: driving by the test site, making sure you know where to park and how much it's going to cost and how you have to pay for that if that is part of it. You're taking public transport, you know where it ends and where you have to walk from, and is there anything you should notice about that, even like what shoes to wear, just things that you don't want to be caught off guard the day of because you could have planned a little bit better. You don't want any added stress that day. So wearing comfortable clothes, comfortable shoes, things you like that make you feel good, your favorite earrings, whatever it is that makes, gives you a little boost there. Familiarize yourself with the test center rules. So some of these things will all be posted at the test center website, but you might actually need to call them to clarify things that you might have in mind, like what can you bring in? Where do you store things? Is there a place for your valuables? How big is it? Can I bring my backpack? Do I need to just bring my essentials? Are there breaks during the test? How do I ask for a break? Are they built in? Can I wear a watch? Just these basic things so that you're not caught off guard the day of. As you're visualizing what the exam's going to be, you don't want to be caught off guard with some surprises there. During the pandemic, there have been some opportunities now to take the exam remotely. And so that's something else. If you fall into the category of doing the exam remotely, make sure that you have your computer battery fully charged, you have a secure internet connection, and that you do your best to find a quiet and private environment to take the exam. That's not always possible where we're living. So it may be something too where you could coordinate with your school to see if they can offer you a quiet classroom or someplace else where you can take your exam. Lastly, you can do this. You're already finishing a program that I'm sure was a lot of hard work and really helped stretch you in terms of your thinking, maybe even as a person as well. And you know your study habits, you know what's easy for you in terms of studying, you know what parts of this are harder for you to study. And so recognizing that as you make your plan is important. I think it's helpful to remind yourself of how far you've come and where you're going, especially in those days when you feel maybe worn out from studying. Listen to people around you who are in the career and about their journeys and about what they find rewarding to help keep you going. When you're taking the exam, just remember too, that don't get hung up on one question. Keep going, make your best educated response and then continue and just try to get in that mindset as you're doing your practice too, of not getting stuck, but going through to the next thing and trying to kind of remove that mental energy on that last thing and fully focus on the next thing. So that takes a little bit of discipline and practice. So something else to kind of think through as you're doing this, which you can do. Just a quick word on what resources we have available through the NPWH. So we do have more than 20 content-specific lecture modules There's an outline available that shows what content is in each lecture module, so you can decide if you want to purchase the whole bundle or choose areas that you know you need more reinforcement. The lecture modules are video and audio. There are pre-post test questions before and after each module to help reinforce content, and it covers all the major content areas in the NCC exam. And it's created by WHNP educators for you, for people that they are so excited to now be part of the greater WHNP community. I mean, this has really been, for lack of a better term, a labor of love from these educators to really work on this for you, so that you can succeed, especially during this last couple years of a pandemic, where we know that it's been harder to learn in a lot of ways. We want to offer this to you as an opportunity to give you our best work so that you can learn from it and hear a different voice explaining the information, and maybe let that settle in a different way, as explain it maybe just a little differently, to help you really succeed in this next step. There's also a practice test you can take. It's really an assessment tool to just practice taking exam-like questions. These were also questions prepared by educators, and it's something that you can do you could do it before you start your studying, you could do it at the end. I mean, you can use that tool however you want. You can go back to the questions. All the questions have very detailed explanation and then references of not only why the right answer is right, but also why the wrong answers are not right. So we hope that that can be a really good resource for you as well. If you also review the NPWH website, there are other CEU like structured lectures and whatnot that you could access to reinforce material. We have our yearly conference, there's the NPWH app, and also, maybe most importantly, a network of other WHMPs who want you to succeed and who want to have you join the ranks of the next step and of this rewarding career. I'm going to make a final note on, as I mentioned at the beginning, taking this opportunity for your study to not only be about getting a lot of facts into your brain, memorizing algorithms, memorizing risk factors, but also take a moment to see what all this is about. Where do we still have room to improve in women's and gendered and people's healthcare? We're not made up of risk factors. I think that we are continuing to see that risk factor-based medicine is really limited. And a lot of the things we assign as risk factors are really misunderstood. Like, just as some examples, like BMI, like race and ethnicity, some of these things that are really important that we continue to do good work in exploring and unpacking and really revitalizing the way that we think about caring for people in the most meaningful way and meeting them where they are and not as a number or a statistic that may or may not really even apply to them individually. So as you go through this content, I also just want to recognize that we know that some of the ways we think about care is still limited and there's still room for improvement. And you may be part of those answers now or in the future. So thinking about, as you go through these, what are the pieces of information that you're learning that really excite you, that you want to incorporate into your care, or that you want to do more research on in the future? What are the parts that frustrate you that we don't have better answers for people? And where can you be a part of that solution as well? I think that kind of thinking can be really motivating as you're working through and kind of trudging through a lot of this just data, but thinking about the person on the other side of that data and how we can continue to improve the profession. And finally, Celebrate now that you're at this point of making a plan for your studying and looking forward and ahead to your exam. You're in the home stretch, whether you're incorporating some of the material here into your education program or you're doing it after you graduated, it's still worth celebrating that you're taking these next steps to do the work. And then I also recommend after you take the exam, putting something special aside, whether it's celebrating on your own by going to do that special thing that you've been waiting to do, or celebrating with people that you know care about and support you, no matter how well you felt like you did, which sure you will all do very well, given you're working towards this now. Um, and you're working to have a plan for your studying, but that you finished a milestone and you worked hard to get to this point and you just did something hard by sitting through a long exam. So I just want to give a little bit of a festive note and a lighthearted bit of celebrate. And that's all I have for you today. I wish you luck in your next steps. And I also encourage you to be in touch with us about what else can we do to help support you in your journey now as a learner and in the future in your career as a WHNP. Best of luck.